Good evening. Before I start, let me use this opportunity to thank you all and Almighty God for enabling me to swear for the second time the oath of office as President of the Republic. The ceremony took place after I last spoke to you. I promise I'll do my very best to live up to your expectations. I'm coming into your homes tonight with some rather unpleasant news. When I delivered update number 21 some 2 weeks ago, I urged all of us to continue adhering to the enhanced hygiene and mask-wearing protocols that have served us well and which led us to the situation where we were witnessing a gradual decline in the number of active cases. However, since that time, we have seen an upsurge in the number of active cases, from a little over 900 to 1,924. Our COVID-19 treatment centers have gone from having 0 patients to now being 4 because of the upsurge in infections. Particularly worrying is the fact that the Ghana Health Service is recording on the average 200 new cases of COVID infections daily. The number of patients requiring hospitalization and intensive care is rising. The number of severe cases, which stood at 18 a week ago, has increased sharply to 120. 2 weeks ago, there was no critical case. We now have 33 in our treatment facilities. Again, according to statistics from the Ghana Health Service, the considerable number of persons who are severely ill are surprisingly relatively youthful persons with no previous underlying health conditions. The number of confirmed deaths has increased sadly from 338 persons to 352 within the period. Recent genomic sequencing undertaken by our scientists have established that some arriving passengers tested positive for new variants of COVID-19. These passengers have all been isolated. Furthermore, work is ongoing to determine the presence and extent of spread of the new variants in the general population. Detailed investigations of the cases indicate that apart from arriving passengers at our airport who tested positive, infected persons have recent histories of attending parties, weddings, end-of-year office programs, family get-togethers, and funerals. At these gatherings, most of them abandoned the use of the masks and were engaged in actions that led to them contracting the virus. Fellow Ghanaians, at this current rate, whereby 13 out of the 16 regions have recorded active cases, our health infrastructure will be overwhelmed if the situation continues. It will severely undermine the efforts government is making to revitalize the economy and put our nation back onto the path of progress and prosperity following the ravages of the pandemic. On 7th January, as I said, I swore to, and I quote, dedicate myself to the service and well-being of the people of the Republic of Ghana and to do right to all manner of persons, unquote. It is my duty to protect lives and livelihoods. In furtherance of this, I've instructed the Inspector General of Police to direct officers, men and women of the police service to ensure the rigorous enforcement of the law on mask wearing at all public places and in public transport. They are also to ensure the closure of all nightclubs, pubs, cinemas and beaches that may be operating in defiance of the law. They will be assisted by the other security agencies, if need be. Persons in marketplaces, workplaces, and operators of public transport must conduct their activities in accordance with the hygiene and safety protocols. The wearing of masks in these places is mandatory. Regulatory agencies will undertake random checks to ensure conformity with COVID-19 rules. Should any facility or institution fail to comply with these directives, its activities will be immediately prohibited and appropriate sanctions applied. It is important that I remind all Ghanaians that severe punishments exist on our statute books for persons breaking the law on the mandatory wearing of masks. Should anyone be arrested by the security agencies disregarding this directive, that person will be dealt with strictly in accordance with law. We do not want to go back to the days of partial lockdowns, which had a negative impact on our economy and on our way of life. But should that become necessary, that is, should the number of active cases continue to increase at the current rate, I will have no option but to reimpose these restrictions, because it is better to be safe than to be sorry. So together, let us all ensure that we respect the protocols. Government is intensifying its strategy of enhanced 3 T's, i.e. tracing, testing, and treating, to allow us to identify infected persons, isolate them, and treat them. A considerable number of contact tracers are being mobilized to follow up on contacts of all who test positive. All laboratories, public and private, must supply in real time data on all persons tested on the common platform established by the Ghana Health Service. There will be sanctions against laboratories who fail to comply. We've also provided additional logistics, including vehicles, to the Ghana Health Service for the supervision and monitoring of asymptomatic cases being managed from home. Additionally, government is reactivating available treatment and isolation facilities across the country in anticipation of any further increase in infections. The provision of adequate medicines, equipment, and personal protective equipment to enable health workers attend to home-based patients is being effected. Fellow Ghanaians, as our children in kindergarten, primary, junior high school, SHS2 and SHS3 resume school from tomorrow, I wish to reiterate that government has taken the required steps to ensure their safety in school. Heads of institutions, as well as their teachers, have undergone the requisite orientation on guidelines for school reopening during COVID-19 to enable them assist with compliance of students with the protocols. I've been encouraged by the preparations being made by many schools, in some cases with the support of their old Students Association and PTAs, in anticipation of the return on Monday. On our part, government has also undertaken the fumigation and disinfection of schools and the provision of sanitizers, masks, liquid soaps, Veronica buckets, rolls of tissue paper, face shields for learners and staff with hearing impairments, and gloves for caregivers and attendants to schools across the country. All senior high schools have been mapped to medical facilities across the country so that any outbreak of the disease in any such school can be duly contained. Suspected cases in primary and junior high schools will be managed by district health teams through the school health program and the COVID-19 rapid response teams. The world is facing a learning crisis, a crisis that is further worsening inequalities in access to education, with children from poorer homes and communities being worst hit. This learning crisis has serious implications for the future of our country. This is especially worrying for me because I have placed education at the center of the social and economic progress and prosperity of Ghana and of her political stability. That is why, in our attempt to mitigate the impact of the pandemic, the CAP Bus initiative, being administered by the National Board for Small-Scale